this rasa and raktavaha srotas. Okay, so hridrogas, once we studied in BAMS or PG, whatever it may be in Kaya Chikitsa, we afraid to treat because that is an emergency. Most of the public also feels it is a emergency and critical disease, but basically hridrogas are easily treatable and reversible with our system. If you are giving a confidence to the patient, so new patient may difficult to come, but already what you are practicing in general practice, existing patients, if they got any cardiac issues, they will come. So don't lose that patient and do practice. Further turning, I am giving a confidence in this session. Mostly I will try, right? So that leads the confidence of the patient parallelly of your practice both. So Hridaya is a mole of Rasavaha and Pranavaha Srotas. You know very well. So then second thing is like Vyanavata, Sadhaka Pitta and Avalambaka Kapha is a Tridoshas is mainly acting on this diseases, and Sadhya Pranahara Marma. This is one of the three marmas, that is Sirah, Vara and Vasti. So generally we will take in Vasti means only bladder, but actually you have to take the Vasti means total renal system. Don't forget it is, because that is also related to cardiology. That's why I am saying. So Vasti on Paribhasha in Ayurveda is not only bladder. Why? Because we are giving Vasti, always Vasti. But according to the disease told by Acharyas, Vasti have to treat it with total renal, considered as a total renal system. So once Vasti Abhigata means that causes the total failure of the renal system also, right? This is generally this Hridaya is formed from Sonita and Kapha in the embryological level. So generally we will classify, you know very well, that is according to Charaka and Madhavakara and Ashtanga Hridaya, 5 types of Hridaya rogas. But Susruta described Sannipatascha is not, right? So that is Vataja, Pittaja, Kaphaja, Tridoshaja and Krimija Hridrogas. The most common heart disease in the allopathy, just it is coronary artery disease, hypertensive heart disease, heart failure, cardiovascular disease, and congenital heart disease. So the terminology is different, but this coronary artery disease, ischemic heart disease, pericardial disease means inflammatory artery disease is comes under coronary artery disease. This hypertensive heart disease also later on develops as the heart failure diseases. So that's the pulmonary heart disease and valvular heart diseases. And the cardiovascular disease also interlinked with this coronary arteries, that due to the ischemia and the dilatation of the vessels and the lack of proper blood flow. So the congenital heart diseases are different. That comes from the genetical, that is rheumatic heart disease, septal disease and valvular disease. So valvular disease has may formed from congenital or later on that. So that's the reason I placed in this heart failure and congenital disease, right? So 5 types of hridrogas correlated generally. So when the patient comes with like atherosclerosis or MI or myocardial infarctions or any like cardiac enlargement or left ventricular hypertrophy or left ventricular hypertensions like conditions, how you will consider is according to Ayurveda, which dosa is involved in that. So if you know little bit, this is a basic doshas only, just remind the first year Vata Lakshanas, Pitta Lakshana, Kapha Lakshana, simply it can easily understand the hridrogas and you will treat easily. No need to go deeper pathology. That's the reason in Ayurveda it's not discussed that much deeper actually. So why? Because the therapy is there, treatments are there, but you don't need to go that much deep pathology. The simple pathology is there. and it is simply we can understand the heart disease. So generally atherosclerosis means, you know, atherosclerosis that damages the vessel and makes the constriction of the vessel, that causes the bleeding in the organs, may heart, brain and any organ in the body. That is due to the bleeding, that forceful bleeding due to only vata. No any dosha will involve. Later, initially may it medho and kapha involved, but the damage that causes the infraction, atherosclerosis, that is due to the only vata. So because that is actually all atherosclerosis disease maximum, this is avarana vyadis. See, that is strokes, every stroke is avarana vata vyadi. So we will treat it as a vata, not like kapha, right? So second is pericarditis, inflammatory disease, that is pittaja hridrogas. There the swelling of the heart chambers and the layers of the heart, outer layers also, the inflamed. So that is pittaja hridrogas. And myocardial infarction and chest heaviness, that cause that is due to the kaphaja. So that called as a kaphaja hridroga also. Chest pain, heart failure and rheumatic heart disease are sannipataja. So in rheumatic disease, some may in some people that develops from congenital, and some in people develops with ama vata. So in that ama, vata and rakta, the kapha sometimes also involved. So that is a sannipata, different. So that's the reason that comes under sannipataja. Krimija hridroga, one parasite is there that causes the pericarditis. So that damages the pericardial muscle. So that leads to the cutting pain and swelling. That is Krimija in classically explained in our Samhitas. So that is also we will discuss later. So common etiology is excess in Ayurveda, excess emaciation, purgations, over purgations like Panchakarma also leads to the cardiac disease. Excessive worry, fear and stress and anger, emesis and ama. Already I said ama dosha, that is ama, and trauma and excessive consumption of hot and very hot and very heavy diet also, and consumption of heavy kashaya rasa pradhana, that leads to the karsha, means emaciation and suppression of the natural urges, that increases the vata. That's the reason. Don't that is in Vadhan Adharayeta, that is a simple, I said already na Sutrasthana. Everywhere application in Rudraga only Sutrasthana only. Just remember it. Don't go Charaka Chikitsa Nidhana, don't need. Simple Sutrasthana implemented in the Rudragas. So Vadhan Adharayeta. So why means that increases the vata. Simple. When you are stopping this urine, then pressures over the brain, pressures over the heart also leads to damage anywhere may. So like same stool, whatever it may, vegan. If you are stopping your jumba, that also sometimes causes the damage of the vessel. So the common pathological pathogenesis is high cholesterol and rich diet, sedentary lifestyle leads to mandagni, then rasadrusti, hyperlipidemia, and kapha pitta rakta medha dhamani pratichaya. Srotoruja, vayu uruja, sola hridroga. That causes the sola and hridroga. That is both same. The pain then leads to may, MI or infraction. That is hridroga. Agnemania, hyperlipidemia, atherosclerosis, obstruction of arteries, that causes the hridroga. Simple pathology. So in this case, what we are seeing, this is normal artery. See, what will happen in atherosclerosis arteries, that atherosclerosis due to that tissue what is present in the arteries, that damages with fatty depositions, that leads to the narrowing of the vessel, then causes the constriction and atherosclerosis, that leads to the over pressure over the heart or any organ, leads to the obstruction, forms a plaque and leads to the bleeding or stroke. This is, see, this is condition, tear in artery wall, then deposition of the fatty material in the wall leads to narrowing the wall, that leads to the clot of the blood also in that organ. So varicose veins, everything where there is a clot and atherosclerosis is present, this is the only cycle of pathology, simple, flat. So common symptoms in Hridrogas, Bhuja, pain is there. In modern also same symptom. Swasa, dyspnea, Kasha, Asya Vikaras, sorry, Asya Vairashya, Trishna, Vaivarnya, Murcha, Hekka, Kapha, Klesha. So these are the symptoms. Same when we are correlating with modern also. Classically, Acharya said the same symptoms present in the modern aspect of cardiac diseases. So already I categorized the cardiac diseases. So we will discuss about coronary artery disease. So coronary artery diseases are the coronary arteries become closed with fatty deposits. Already I said. So that leads to the damage of the heart muscle, then leads to the myocardial infarctions later. That is coronary artery disease. C. That causes the heart attack, angina, arrhythmia. Atherosclerosis obstructs and cardiac heart attack, angina, arrhythmia. This is one slide only. What is MI? You know? Yes, right. So myocardium is a layer of heart muscle. So in the small bleed, that is the first sign of first stroke. If the patient aware in that condition, that is no need to go any surgical intervention, no need to go any cath lab for catheter, right? So simply we can treat with better treatment in our system. If it is in a massive stroke, no one can survive. They collapse in even bathroom and bedroom also. Even allopathy also not safe at the stage. First stroke and second stroke, if they aware, then they will save with our system also. So generally what happening today, even though 40 to 50% of coronary arteries blocks also underwent catheterization, nothing but stent. So that may damage that I will discuss. Why stent is not advisable, I will discuss later on. Okay. Yeah. So the common symptom of MI, first attack of the heart attack, is pressure in the center of the chest, pain in shoulders and neck and arm, chest discomfort and fainting, sweating, nausea. These symptoms also comes in Mudhavarta also. See the differentiation. First of all, whether this is a Mudhavarta or cardiac stroke. Differentiate karna. Mudhavarta mein mostly the Mudhavarta comes with one. No? Yeah. Yes. Sorry. Yeah. That differentiation is only one thing is in Mudhavarta the most discomfort first starts. Later on that chest congestion. Later on that pain in the chest, not in the hands. So pain in the chest is not a cardiac problem. So you should clarify and differentiate it. First, any cardiac problem, the first symptom is chest heaviness, not udhara, not bloating. So same like many people comes with, sir, I have lot of pressure on the chest, I feel heaviness. And same thing you have to question them. So you have any bloating in abdomen? First of all, you have to check it. Later on that when you are taking food, what happening, is digested or not, everything has to take, even the cardiac patient also. So later on that you have to decide chest congestion is there or heaviness is there. Then any pain in the arms, may sometimes pain not get in the arms also, in the mild MI cases. So the only thing is discomfort and sweating is one of the symptom. Nausea is also present and chest center pain is common and major is mild dyspnea is present. So that is the differentiation in common with the Udhavarta, means bloating and causes that, sometimes like we can treat, see like GRD also feels like sometimes. Okay, you have to differentiate them. Yeah. So Susruta, Krutsula actually tell in Gulma. So Gulma is the sana of Hridaya, already Dr. Ravikant sir already told, right, on the day. of second or third day. So in that Rutsula is one of the symptoms. So that's the reason Gulma Pratishedana Adhyaya, Susrata said in that Gulma Pratishedana Adhyaya. So this is only reference. So angina. So you know angina is simply chest pain and erythema. So it is irregular and beating of the heart is erythema. Just to know only I made a slide. Okay. Ischemia. What is ischemia? So reduction of the oxygen to the organ, any organ is nothing but ischemia. Maybe brain, maybe heart, maybe kidney, maybe liver, whatever it may be, hand also. So reduction of the oxygen and the blood flow is nothing but ischemia, right? So that under simple vata. Simple, it is a vata. It is obstruction, that is avarana, it is a vata, simple. So how we will treat? Later on we will discuss the treatment, but we have to know first of all. So pericardial, already I said in inflammatory heart disease are nothing but pericardial diseases. So the most causing factors are, you know, cigarette smoking, uncontrolled hypertension, uncontrolled cholesterol, nothing but hyperlipidemia, uncontrolled diabetes, and family history may, and stress, tension, and obesity. Nowadays the major problem is obesity. So why? Because we are eating, no going any exercise, not doing any walking like exercise, not taking proper limited diet, and we are taking lot of carbohydrates, rich carbohydrates, everything leads to the obesity, you know. So that cardiovascular disorder associated with obesity is simple: hypertension, stroke, coronary artery diseases. This is the global CVD, coronary vascular diseases death rate, now in 17.9 million. Total death rate of 32% global death. Every day we are, after COVID also, we are seeing a lot of people is suffering with suddenly death due to the cardiac arrest, because sedentary lifestyle and because of improper exercise, improper management of stress, all these causes. This is a major issue. Particularly myocardial infarction is the basic death cause of the most of the cardiac diseases. See, in these 26 years, 34% of population is death due to the myocardial infarctions only. So generally, what is the treatment for any ischemia and infractions? Can you tell? Anyone? Commonly we will listen, sir, we will went the hospital, they done angiogram, later on that this much of block is there, this much of block is there. So on the table, doctor, sir, this is emergency, we have to do catheterization, nothing but stent. So otherwise they will die. If really people will die with 40% to 60% stenosis, is it fact? Not, right? Why? Means even though you have done the catheterization, that also leads to the another further blockages of the vessel later on that. So that is the only simple temporary relief only. But nowadays that is very, very common. So they are taking lot of medicine on lifetime while going 20 years, 15 years. Later on that, once if it is stunt fails, may causes sudden death also in the after stunting within 1 week. May if it is success, it may later on like 15, 20 years they underwent to the bypass. So that is happening today, right? So it is generally heart have lot of bypass channels. If one vessel is blocked, that bypass the another vessel to the heart. That is God's gift. That is human heart structural anatomy. So most of our what we are doing, the mistakes, that causes the non-bypass of the heart block, that causes the death actually. So if anyone have a block identified, then after that, if any people will start their lifestyle changes, then definitely that blocks will reduce and the flow of the blood will bypass naturally. How I will explain later. See, general conventional treatment is only PTCA, CABC, and allopathy medical management. Even though we are afraid to treat cardiac diseases because of only in emergency of fear, not emergency, only fear. See, so we give the confidence to the patient. If they are already your patient, if anyone comes to reject this stunting everything, then explain them and properly educate them and treat well. How to treat, I will explain, but you should study and do your own also. This is only model to how to understand, right? What will happen in stunt? So they will stunt with balloon. They will insert the catheter in the arteries. Later on that blood will flow. But generally, our arteries actually has a lot of vasodilatation nature is there. But what will happen here? If they done the catheterization, natural vasodilatation will damage. So this stops the vasodilatation and permanently reduces that dilatation. Later on the same, even though catheterization, later on the same block will come either front or back, whatever it may be. So what is the use of this catheterization? I think you can understand. Okay, that is a modern concept, whatever it may be. But according to our system, how we have to treat, we'll discuss. Our questions on in our mind, whether Ayurveda treatment is effective improving the patient with ischemia like cardiovascular disease, whether it can really reduce the mortality rate, can really avoid the angioplasty. That's what we are discussing. So most of the people afraid for this, if they are not going any angioplasty, they may die because of fear, because of stress. Okay, can we treat confidently? Say. Yeah, thank you. Yes, definitely yes. How? So these, how we will consider this disease in Ayurveda? Simple. This is Vata Kafacha Hrudroga. What is Vata Kafacha Hrudroga? Any ischemia, first is Vata, then is Kapha. Simply Avarana. Also I said already. Second is Srodho Rodhana. That damages the vessel and causes the block of the vessel, leads to the disease. Apanavayu Rodhana or Dushti. This is the major cause. Vyaghan Bharayedhat. That improves the Apanavayu, that damages the remaining vayus. Right? Treatment principle, simple. Shroto Shodhana. You know Shodhana very well. How many Shodhanas we have? Vamana Virechana Vasti Nasya Rakta Mokshana. Right? And another more Shodhana is Bahya Shodhana is Abhyangana and Svedana also Shodhana. Okay? Patya. What they have to eat, what they not. We have to tell them. Which type of diet they have to take. Vyayama. Nothing but exercise, yoga, meditation, walking, running, whatever it may be, sports, anything. Hrudyam. After the treating all this, we have to strengthening the cardiac vessels and re-strengthening the muscle. Because of that block, heart take lot of load on the. You have to strengthen the heart remains. That is Hrudyam. Hrudyam, you know the meaning of Hrudyam, right? I think. Can I say? Hrudyam, that improves the quality of heart, that gives the strength to the heart. Nothing but Hrudyam. Simple. Methodology to recovery. Only 3 months diet is enough, or 4 months maximum. If anyone is not misleading with the diet, 4 months maximum. You can choose Panchakarma. Simply for 3 months, different Vamana Virechana on the intervals. Regular exercise for 3 months. If any diabetic patient, you have to monitor the diabetes also. Sugar level checking in the diabetic patient. Most of the atherosclerosis due to diabetic patients. So that's the reason I added this one. So we have to monitor the diabetic value also. See, simple. Fruit, veggies, whole grains, plant-based proteins, healthy fats. What is healthy fat? Whether ghee is healthy or not? Can you tell anyone? Healthy or not? Can we take ghee to the cardiac patients or cardiovascular patients? How? How can you explain? If anyone taking snehapana, taken, your weight is increased or decreased? Ma'am? Yes. If you are taking snehapana, your weight will decreases, not increases. So reduces. So simple. If you are taking the saturated and amino acid good fat, that reduces your weight and improves your HDL and reduces the LD and VLDL. Simple. In modern aspect of talking. Okay. So once diabetic, once cardiac patient, don't take ghee. That causes the heavy fat in your cholesterol. So you can take that refined oil. Yeah, very much. Is it suggestible? Yeah. So you have to learn. Don't go like all. So you have to study according to Ayurveda. So Snehapana simple. That is keto diet. Snehapana keto. When you are giving the keto diet, automatically the body itself reduces the bad cholesterol. Body itself synthesizes the good cholesterol. Liver reactivates and HDL improves. Automatically, the total muscle and vessel fat and muscle protein will improve and strengthens the heart and arteries. Simple. So ghee is a lot of amino acids and good saturated HDL fat. If it is a pure, not a dalda, right? Okay. Simple. Healthy diet, fruits, vegetables, and reduce the sugar. Carbohydrate is a major cause of atherosclerosis. You know very well that improves the bad cholesterol in the body, not only the non-saturated fatty acids. So rich carbohydrate is a very danger. Reduce your sugar and reduce your carbohydrate rich food and intake. You have to improve the good vegetarian based protein and improve your whole grain and fiber and low. See, select your diet with 35% of carbohydrate, 40% of protein and 30% of good saturated fatty acids. Then this is the only treatment in that. Is any difficulty? Simple. See, all these you can do. Nasya. Why you have to add in heart disease nasya? You know, already I said that is vata, avarana vata. That may cause a stroke in the brain also. That, you know, sirogata vata nasya is a first line of treatment. And second, swedhana. First, you have to abhyantara swedhana also. When you are doing abhyantara swedhana, that over electrolyte like sodium, chlorides, and excess in the your amount of it will comes out, and excess fat will also comes out from the swedhana. That reduces the higher lipidemic condition. And the second is vamana, you know vamana, that reduces the kapha dosha and reduces the fat also. And pathologically, snehapana, already I said, rakta mokshana. In few cases, if like varicose veins, deep vein thrombosis, we have to do rakta mokshana in the treatment principle. Virechana, vasti, abhyangana. Abhyangana and swedhana is okay. Vasti. The center major part is dhara. You have to remember it. The most atherosclerosis and diabetes due to not eating high, not only high eating carbohydrates, even though who are very lean, they are getting strokes also because of only stress. See, the higher atherosclerosis due to the stress, not only eating carbohydrates means that much of obesity, they will be gone, had to gone. But even the lean persons are getting cardiac arrest, brain stroke due to atherosclerosis of the stress and Karsha. Already first point I said the increasing Vata factors. So you have to do Dhara. Which Dhara? Okay, Sirodhara. Which Dhara? What? Right? Takradhara. Good. Takradhara is the first line of treatment in all Hridrogas and stress related diseases. Not Tailadhara. Simply mind it. Why? Because after once if it is in a brain stroke, then we will treat like Tailadhara and Sirovasti like. But while reducing the cardiac, we have to reduce the cardiac disease. You have to give Takradhara. Takradhara is the best treatment for psychosomatic disease. Even though Takradhara is very good for skin diseases, all Kushtarogas. Okay, remind it. So we have to do exercise on not under AC. Okay, don't go treadmills. Go outside, do aerobic exercise, and even atmospheric exercise also. Not with 20% temperature of AC room. And I am doing exercise in every day with treadmill. That never gives a good result to you. So sweat has to come out. Sweat has to come out. So yoga. In that yoga, you have to do maximum extent of asanas. That gives a lot of sweating and improves the biological function of every organ. You know very well, yoga is a very, very better than as compared to generalized exercise. And pranayama. Why I suggesting pranayama means when you are taking a lot of oxygenated air into your lung, that reduces the heart rate actually. Little bit speed up of the heart rate. Simply, when the heart rate will reduce and controlled by your pranayama, then the lifespan will increase. Then oxygen will get a lot of already ischemia. Already what I said, lack of oxygen, right? So that ischemia will reduce with the pranayama. That improves your oxygen holding capacity in your body. That improves the quality of life and improves the lifespan also. That is important. And meditation to control the stress and everything. Right? Simple. While you are doing this, while you are doing simply exercise, the vasodilation will occur. The simply vasodilation means generally any plaque, any block gradually will reduce. So that is the reason I suggest. These are the medications you can apply according to the Rasaguna Virya Vipaka in different diseases. My best simple drug is Arjuna Lasuna Ksherapaka. I advise all Rudrogas. Why? Because Arjuna is a best Vata Kapahara, Lasuna also Vata Kapahara, Avarana Vatahara, and Kshera is Pitta. Why? Because Sonita Rasava Sroto Dushti, right? So Kshera is Brahmana and parallelly Pitta Samaka and Virayachaka also. So that is I suggested Lasuna, Pippali and Arjuna Ksherapaka. Right? These are the drugs. So sorry. These are the rasaushadhas we can use in according to you. So in that I will explain about Nagarjuna Ras. Okay. If you are facing anyone facing like hypotension, what will you suggest? Generally, water, lemon, salt, right? But even though you are suggesting every day 2 liters of lemon water, but BP never comes up in some cases of cardiac enlargement cases. So it under like 90 only, systolic, 90. So in that cases also they feels like heaviness of head, reeling, sometimes weakness, all these symptoms they feel. So this Nagarjuna improves the hypotension to normalize the BP value and improves the quality and reduces the swelling of the heart and quality of the cardiac muscle. This is why I am suggesting is remaining Hridayanvarasa and all these are protecting the cardiac muscles and everything. But Nagarjuna is specific for that also. Hypotension. So generally we will suggest simple. So hypotension, Nagarjuna brothers, mind. So clinically I am seeing lot of cases, that's the reason I am explaining. Hypertensive disease, nothing, getting angina and heart failure. Hypertension's avaramata. So hypertension is a big question to Ayurveda. How we can consider as hypertension in Ayurveda? There is no terminology in Ayurveda, right? There is no terminology in Ayurveda. But already I said in the first initially, we have to see the only dosha pradhana. So simple. This is avaramata, mohdavata only. So that causes the atherosclerosis. Due to that only, hypertension may increase, stress also, mohdavata, apana vayudushti, and all these conditions, hypertension will increase. So that may cause heart failure, aneurysm, kidney failure, stroke, and all these things, blindness, vision loss, everything. So simple. Vataja pradhana. If you are feeling it's a vataja pradhana on nadi and the symptom, give this combination, pittaja pradhana and kaphaja pradhana. Meditation, pranayama, exercise, and common is sarpagandha, jadamansi, archana. These are the gunshot drugs. You can give it to any hypertensive patient. Okay. Heart failure, congenital heart failure is also known as heart failure. So coronary artery disease, cardiomyopathy, and pulmonary heart disease are the major cause of heart failures. So ischemia, cigarette smoking, hypertension, obesity, diabetes, and valvular heart disease, same. Shortness of breath, fluid retention, fatigue, loss of appetite, weight gain. How we can consider in Ayurveda? Vata sopa, vata kapha hridroga. Okay? See, vata sopa chikitsa, hrudyam, aushadha prayoga, simple. So we have to give dashamola, patya punarnavadi kashayam, bala sharyakadi kashayam, sometimes, and sitarikadi kashayam, all these are there. Vata sopa hridroga, sofagna chikitsa, hrudyam, motrala aushadha prayoga, simple. Line of treatment is motrala aushadha prayoga. These are the drugs. This is main important. When you have a cardiac enlargement is there, when the cardiac muscle function is very, very weak, you should do Hridayavasti. I think you know all these Kativasti, Januvasti, Griyavasti, everything. But Hridayavasti may not practice everyone. Hridayavasti. This is a very good treatment. I am treating a lot of people. Their cardiac function is improving. Regurgitations are reducing. Their valvular problems are reducing. So you can, according to the dosha, say if it is in a vata kapha and already it is a shodha is there. So if it is in a vata kapha, use simple Kanvantar Tailam. Simple. If already shodha is there, if it is predominated vata, Narayana Tailam is there. If any kapha predominancy is there, use Kottam Sukhadi Tailam with Dhanvantar Tailam. So vata is common, predominancies will change. That is the only treatment. Just simple tailas. Okay? Cardiovascular disease, you know very well. Varicose veins, atherosclerosis, thrombosis. Congenital heart disease, you know, rheumatoid arthritis and cardiac diseases all. Rheumatic heart disease, septal disease, valvular heart disease. Already I said Krivija Hridroga. Really, no one is seeing it every time, but it's present. So this is the article published in paper, Krivija Hridroga. So on the days, okay, identified Krivija Hridroga. So I created a lot. See here, EF is very low, 22%, but they have metal regurgitation is 2%, and tricuspid regurgitation 1+ is there. Dilated LV and LV, global hypokinesia of LV, grade 1 diastolic dysfunction, mild MR is there. So after my treatment, their metal regurgitation total cure. tricuspid regurgitation also total cured, and dysfunction is also reduced. I think you observed the same patient, Ravanamma, right? See, this is one of my case, that cardiovascular case. This is a trauma of right upper limb. So, thrombotic occlusion of the subclavian artery, axillary artery. So, in the modern doctor is suggested, see, left. See, this is they suggest the treatment, right brachial biopsy with graft. What suggested? Right brachial biopsy with the graft. After my treatment, video, I think it is not played. ఇది వీడియో సార్ ప్లే అవుతుంది. ఓకే అని వీడియో ప్లే చేస్తాను. అంటే వీడియో ప్లే అవుతుంది. ఒక్క లేదు మీకు వాట్సాప్ మళ్ళీ చూద్దాం. ఓకే మీకు వాట్సాప్ చేస్తాను. ఓకే, ఐ విల్ సీ ద వీడియో. So this is one of my case. See how much the EF is there? 30%. Later on that 46%, 63%. It is improved ejection flow. This is actual heart failure case. So simple prevention of the hridroga is better than the cure. So first we have to suggest the patient with the symptom of cardiac. You have to suggest what I suggested: diet, exercise, medicine, whatever it may be. So you have to change. They have to change the diet and lifestyle modification and give the rasayana therapy. Also later on that after treating. So in this case, she has an age of 74. See, 68 at the time of treating. Later she lived up to 76 years. She gone. Like general death only. Nidana Paridarshana only. This is the combination of yoga and asanas, simply in the cardiac diseases. So Arjuna Churna, He Durta Kuda, Hridroga, Jeerna Chara, Rakta also, Pusta, Vedanga Churna, Gomutra, Krimija Hridroga, Nagamala Mala, Buddha Haridra, Kasaswas, Pushkaramala, Udayashura, Swasakasa, Tikka, Drakshara, Saridi Kirtiza Hridroga. See all this. Nagarakvala. Thank you. Video పంపిస్తాను సెపరేట్.
So the videos also in the evening if possible. Hello. What is it? So thank you so much, Dr. Satyanarayana. We need more and more doctors, young doctors, who can handle heart problems confidently, so that it will be inspiration to the next generation. Now I request Dr. Sirisha, Dr. P. Sirisha, who is the medical officer, and you will be. This will be the what we call climax of the Nari Shakti today. You have seen wonderful women from various departments. Now this will be the end. You will see how a wonderful practitioner, along with good communication skills, will be able to convince you to practice Ayurveda. So without any delay, I would like to hand over to Madam.
So we pets and పెట్టావా అంటే మీకు క్లిప్ చేసుకో.
With pranamams at the lotus feet of Lord Dhanvantari, I would like to start today's session. Is it audible? The clinical approach and it's not good. Normal. Yes. Is it audible? Hello. Is it audible now? Okay. Okay. See, with pranamams at lotus feet of Lord Dhanvantari, we'll start today's topic: clinical approach and management of renal cases in Ayurveda. See, all are enthusiastic to know what renal cases are there and what we can do and how much we can earn. Antena? Huh? Everyone can follow Telugu? No? Not exactly. Only English. See, in between, if some few words flow in Telugu, you can flow with this thing, speech. Okay? This is what I wanted to go up with. అది కంఫర్ట్ నాకు ఓకే See, just going to the renal case, what exactly I wanted to speak now is only renal. Okay, not going with any KUB like ureter or bladder or anything, because we have a direct references in the classics, isn't it? Mutrakrutcha, Mutragata, Asmari and all. When we refer the classics, we have separate chapters, we can directly refer and we can directly treat. Okay, is there any doubt in those cases? No. But when such case comes with some renal problem, where will you refer? Any chapters are there in Samhitas? Just open the chapter and just refer it and treat it. There is no, yes, chapters are there. Content is there. Some reference is there, isn't it? Yeah, it's good. So we are just going through what the references we have and how come we use that clinically. Okay? See, just when some person comes with a renal case and sits in his patient chair and we are in the doctor's chair, what they present? Just only the weight loss or some poor appetite. They come with swollen legs and ankles, isn't it? Will any one of you say some symptoms or anything like of a renal case? Puffy eyes, then pediatric pain, the at specific point, renal angle or the groin to groin. Pardon? Yeah, okay. Another more? See, almost like they say with some tiredness and even itching. In the chronic cases we find, and insomnias also we find, and shortness of breath. So this is the clinical presentation of a renal case when they just come and sit before opening the file. Okay, they come up with this. And what they say next? Some urinary symptoms. Say, you want to speak out some? What will be the urinary symptoms like? Burning sensation. Yeah, next. Polyuria, next. Mainly at night. Next. Albuminuria, proteinuria, some, and almost we get some reports like with glomerular filtration rate. That also we'll get with some reports. Okay. And next they come up with creatinine raised, serum albumin fall, fall or rise? Will it fall or rise? Fall. How many say fall? How many say rise? Rise or fall? We'll see. Is lipid profile related to a renal case? Yes? Yes or no? See, don't get misguided. Not all those are related to renal case. And just put some side headings only. Okay. Is lipid profile related? Yes? Then we have a scan report directly presenting. It is a diagnosed CKD. Isn't it? Grade 1, grade 2, grade 3. So I don't want to go into those grades. Okay? So what we see about this Vruka in Ayurveda? Directly Vruka, we find only these terms, isn't it? Is a Matrujaryava and how it is formed. I am not getting it. What? From where Vruka is formed? Sushruta Sarira, Sloka? Rakta and Medo. So, okay. And further references where you will see the word Vruka. Srotomulam, which Srotas? Which Srotas? Huh? Medavahanam Srotasa? Vruka? See, you all are final year students? Final year or fourth year? Third year? Even second year you will have RV and VV and Srotas. Huh? I want that sloka. Medovaha Sroto Moolam is what? Huh? Snayus? Just one line. Vruka and? Excellent. Kati Vrukocha. Vruka and Vapavahana. See, next we for Svedavaha Srotas. What is the Moola? And Meda and Romakupa, exactly. See why I have presented this Vedavaha here direct no Vruka, but Medavaha Dhatu, it is the Moola for formation of Vruka, and now we have taken Svedavaha Srotas because its Moola is Medo Dhatu and Romakupa. And next Mudravaha Srotas, Basti and yes. But why I have taken that? How that is Mudravaha Srotas related to Vruka? I am just speaking about Ayurvedic part. No polyurias here. Why? So it will come. Okay, I'll say. So just I have kept the kidney in the center and just see what all we have to keep in mind before going to a renal case. See, we have seen Rakta Medodhatu and Medovaha Srotas and Vapavahan, and it is a functional Agni at all the levels. What will be the functional Agni there? That concern Dhatvagnis. Okay? Dhatvagnis and also what? See, I am just going back to the physiology and asking, pulling out all the things. It's like Viva? No? See, that functional Agni, when we go into the deeper thing, we have to first correct Jatragni and Bhutagni should never leave, but the specific Dhatvagni you have to identify. Okay? Can you identify when a patient sits there, what Dhatvagni is affected and what Bhutagni we have to keep in mind? We will ask about only Jatragni. Isn't it? All the remaining Agni is gone. But it is needed. you should never forget what doshas, dhatus and srotas and what upadhatus and all. Because when a patient comes and says some symptoms and all, just we should be very sharp to identify at what dhatu level it is all going on. Okay, this is important only for the cases where there is no direct diagnosis or a direct chapter is there. Okay, for the rest of the cases also you can go, because what it is said in Charaka, we need not name the disease. You can go with dosha, dhatu and whatever samprapti is there, we can identify it and we can treat it. We need not name it. So these all comes under that category. So we have to remember, recollect when a patient says some symptoms there, we have to recollect which dosha, which dhatu and what dhatu level we have to treat it. Okay. So what levels here he has said for a renal case, which dhatus we must remember? Rakta and Medo are there, but precursor is Rasa and in between is Mamsa. So Rasa, Rakta, Mamsa, Meda, up to that level we have to see that case is at what level. Okay, that need not be on the chronicity. If it is 10 years chronic, it need not go to the only Medo. And it is just started because, so it is at Rasa. It is not like that. Just go on analyzing the symptoms, and some will be at all the 4 levels, or some, even if it is a chronic, it will be at the starting level only. Okay. Rakta dhatu level, we have the Sundar Raj Telugu and Kaishar. So Patati is also there. So where we have to select it on, I just, in case study, I will show you. And see, Arjuna, Amla, Viranga and Alavya. So whatever I am using in the practice only, I am saying this. Okay. And next, see, the way how they have entered, so some protocols they have said, no. So just wanted to that I am Madam, they have said this expression of base over what is the true translation what to study. But I am Madam is complete body will come. Okay. So the surveying Madam, the whole will come into that only. Okay. So that condition is just Vidya and Vishnu Siriya. Until instead of a renal case, you can identify in a very chronic case. You see that we can go with any of the data and maybe the particular and Basha and generally do it. Next, what we have seen, that is the Mutta dosha only, no? That is, that we can go with Mutta Videshini and Mutta Bashayas. And next, when they come up with weakness and what we have discussed, the Sarvakala and Sarvakala Sadha and all, initially they come up with these symptoms also. So there we need an assignment. Finally going to the case study. So this is a patient 9 years. So many of edema or occasionally and breathlessness. And see the bad side of the case is he was diagnosed with narcotic syndrome at the age of 2. So for the last 7 years he is on medication. So all steroids. So finally the stage has come where they said all our drugs are completed. So we can't do anything. And finally we must go for a biopsy whether to see what is happening inside. So that is the time they have come to me. It's very short, 9 years, but to me like only a 5 years kid. But this pressure is only there. So he takes and he's done. Whether I'm going on talking with him and he's just sitting like that. So we can just identify with him what the levels are there. See, and albumin urine is 4 and serum is okay numbers. It is less. Less or more. Less. See, we have come to me very, very free. We have started it. Arjuna and the answer that we use? No? Yes, sir. What is this not? What it is doing here? It is not taking up or it is not what is happening there? Because albumin is less. So what is happening there? What is happening at the level of arms and arms? It is not taking up. It is not doing its work. Okay, it's not taking up. It's taking up or it's not taking up, but it's overtaking. It's not taking up. So what have we have to correct? Arms and arms we have to correct. What method is doing? It's producing more. Okay. Answer is not doing. It is bypassing answer and going to method. Isn't it? So what we have said is first answer and method rasa also. We will want. So what you are repeat from that what is that method you have directed it to method, but is mula liver is also we have to take it to consideration, isn't it? So only thing that is rasa. That should also be treated. So first we have started with Arjuna. I said at the rasa level we go with Arjuna. Arjuna, Eshrimantu, Chandraprabha and Purnarnava. That is the first description I have given just to see how he reacts. Because it's just an idea of with lot of negated conditions. Isn't it? So after that we have added Purnarnavasana and then Madhura Vatana. And in between we have a Rudrajasana, Raspudarishta also. In between we have, depending on his presentation, clinical presentations, we have added and we have removed it. Okay, but the candidate in particular is Purnarnavasana and where we have started with Chandraprabha and finally we have come to Ashta group. See, all the drugs can be used in Pinakis or not? Can they be used? They must be used. Okay, so we have taken on this. We have started in 3rd month of 2003 and now see the 9th month you can just see the variation from 600, 500 to it has come to 200, 195, 52, 190 and 39. So after 6 months. No, just wait. Okay, after 6 months it is here. We still continued the course. And one happy thing is he started growing tall. So his mother is very happy. And his 0.9 and 1.7 finally in the month of April 15 this year he came to 3.6. So okay, his Vedodakani, Amsadakani both got corrected. And his lipid profile is sorry, except for the total cholesterol it is 200 borderline variation in men. Otherwise, God came to the normal. So the correction is on this we have done. But one thing is still protein loss is there on and off. So the complete correction is not done. So we have started from the starting and we start going on correcting it. But when we are coming to now only to correct the nonsense way apart. Okay, so first we have to correct the moola. Then they come there now. After 1 year, again they are now. Not getting everything. But only the protein loss. See, these are these biopsy reports. So you can just see it is a complete normal report. They have given with one word added. There may be some immunosuppressive therapy working on this, making the underlying renal cells to reform into normals. With 70% of the ones coming to the normals, the one drug you are giving is Purnarnava. What Purnarnava will do? Will make it. So, until I have seen this biopsy report, I could don't know. That will act as that, but the critically we see that some but this is the evidence shown because they are not going with any other drug. Okay, on and off they are using the steroid whenever is during protein loss is 4 test. Suddenly the episode comes for 3 or 4 days with 4 tests and again it comes to mark. That why that episode is coming, now I have to do research. Okay, on that I could come up. So the complete reports are they have come normal, and what the nephrologists have suggested is continue with Ayurveda and tell your man look after the protein loss in urine. So that is what they have said, and that is what we can come up with Ayurveda when we understand it. So there were no direct differences, there were no direct thing, but when we enter into it, all the arteries are clear and all the calcium is clear and all the result is very clear. Okay, see it is the time when we have albumin stages here, but on and off it is coming out. That still connection is there. So this is the boy, it's very started low, but now we started growing. Okay. So this is the case now. So I don't want to name the case as nephrotic syndrome, nephritic syndrome or something CKD. I don't want to go with because whatever the symptoms they say, only the group of symptoms which they don't understand the common pattern. But they have a common thing behind it. So we will not name it as a symptom. So the second one is, now that is a 9-year one, this is a 32-year one. So we have come up with the same thing, weakness and unable to do his protein loss and not able to go to his office and his medium grade. And see, he has come up with a scan report with the SAM CK. And what happened here is the renal size is decreased. Small kidneys. They have said, so it is a chronic CKD grade 3. And this creatinine is 3.6. See, in that case, we never find any creatinine variations in that case. Only the loss is there and it is there. The correction is at the what level? Narvavi, Saravaga only. No entering into Pitavaga. Okay. Here creatinine 3.6. See, he is the 19th. The last one he has come up. Again, I started with the same Punarmama and Arjuna and added Krishna. Okay. See, and we still continuing it and here also we are going with Arjuna, Utsira, Punarmama and the same combination line we are moving up with. See, after 15 days, I said him use for 15 days and come back. But he understood after 15 days it's go for a scan. So he came up with a scan report. That is a very blessing to me because I could find a change in the kidney size there. After 15 days, you can see the date is 11/5. I started in around 19. So around like 3 weeks, it's from the 6.2 into 4.2. There, came to the right kidney is 7.3 and 3.1. So, and the second one left is 7.1 and 3.4, it is 7.6 and 3.2. Okay? So, the size of kidney can also be increased. And here it is, see, we have, it is bilateral way 3 renal parenchymal disorder. So, here it is the bilateral scale. So, that organ regeneration has started up, but the size has almost come to the goal. But one thing we see is that orthometabolic demarcation is not clearly established. It's only 3 days case, 3 weeks, right? We will come up with the future reports in surely not. Okay, just like that, so is even the size will start improving. Okay. 3 or 2 or 3 weeks itself. Okay? And see this one, we can, it's just very, what to say, we have short duration I have taken again, but we will be taking long. It's not like a 1 month or like I got the case, because we are correcting it, and we are not looking at that way. Just change the, what the derangement is that change we are not targeting up, but we are targeting on the mood Lyric is read normally with no density or weakness or anything like it is read. It is maintaining a normal right. Happy. So this only thing I wanted to say is when a case comes up with some name which is not with a directly find in the Samhita, just don't be panic. Just think about the what the methodology is going behind and what the authors or doshas or doshas are required. Just with symptom we can get otherwise they come up with some deranged lipid profile. Lipid you see, lipid profile given is there. Then we go with the brand. What is the formula? Then you will get it. Isn't it? And otherwise PHI is there. Or some drug you wanted. You have a specific this PHI is there. PHI is there. Isn't it? So PHI Maya people is there. Or Amaya is there. What is PHI? What is PHI? Other thing only, no? That if you start understanding the term meaning, that means you know the Sanskrit completely, not even completely. That's what you try to learn Sanskrit at least a little bit. What Agatha is there, that's coming outside and within. Agatha is do not come from inside. It is something outside affecting the Viha. That is going that terms you I say. We are set through what is whichever is acting directly on the functions of the Viha, so that it is the set through. Okay, Viha Amaya. You move the diseases of the Viha. There we go with what is Viha Amaya? Vipali. Viha Amaya Vipali. Viha set through is Selapunga. Set it. You are writing your MPC and Pagadas also you are not writing. You are not writing Sotamundas, Slotas, Dhatus, functions. So, we just start exploring arena and we will find solution for all the complicated issues or simple issues also. Okay. Finally, I want to end up with one thing. We have seen the renal cases of a child, middle age and thing, but when a renal case of a fetus, how do you identify it? If they are going, taking a food, and then the 5th month or 6th month they come up with polyhydramnios, isn't it? Amniotic is increasing, and then before they later the renal kidney will be showing hydronephrosis or some deranged condition they are showing. That reports are not just not presented in the case. So, in such case, when they come up with the polyhydramnios, even if they are diagnosed with fetal renal disorder or not, you can happily start with Punarnavadi Mandalam just telling them that you will improve your hemoglobin. No problem. It will automatically correct the polyhydramnios condition and it will automatically check the fetal renal problems. And one thing I found is this Punarnavadi Mandalam can cross the placental barrier and enter into the fetus. So there also you will find the best of the best results with Punarnavadi. Okay, so happily you can practice just learning into the basics, looking back into the Samhitas purely in Sanskrit only. Okay, and thank you all for your patience.
Thank you. Dr. Sirisha, for your wonderful presentation. And I request Anjamurthy sir and Basra sir to come on to the dais, share your inputs and felicitate both Dr. Satyanarayana and Dr. Sirisha. I want one volunteer, great volunteer. Everybody comes. So, see, observe this. You see that there are acupuncture points for each individual. So this is the detail point. This is the irritant point. This is the dagger point. The irritant without standing, without being still also, we can identify where is the problem. But we should be clever. Don't use nails. If you use nails, you will injure the person. You can use this portion. And so you identify. So 9 minutes massage here, 9 minutes here. You should mark the referral to Nandi. You have to do it. So if you do like this, in conditions of pain and harm, very severe pain is there. I was traveling from Mysore to Hyderabad in the bus, the exam for MD. By the time the late person is there, so I have forgotten analysis. I have severe pain. In bus itself, I did this. This is by my side now. Just I do this process and within 9 minutes this way came out. This is helpful in conditions of breathing calm. When there is storm, you have to go for another procedure. It's not a temporary procedure. And once you learn, once you reach the procedures, you home, you can apply some coconut oil, something like that, and you can do this. See, Sirisha and Madam has done wonderful presentation. So, we have cardiologists, we have urologists, we have nephrologists, our friends, only we should be able to recognize them. Correct? Please come here. I don't want to do the detailed lectures and make some points and just want to give it. In my practice of 50 years, I had concepts of hazards, concepts of problems, and I want to give you what I have learned in my 50 years. Usually what happens, a person is having Pali shoulder and ocean shoulder. In ocean shoulder, people are afraid, oh, this is very serious, very problematic, not going to complain. But within 20 minutes, you can reduce the ocean shoulder. Temporarily, ask the person to pass urine, stools, and sit in the tub or Australia. Give it a full tub. Full tub. Then we use division of pushpa. There is a lot of division of pushpa particularly. You can tie down the division of pushpa in a cloth bag and put it in the tub. Hold the bottle with the ishkal. Let's say, so you just, in Australia, your procedure is there. What is the water level above the nabi? Please refer this textbooks. The symbol of Australia. Australia should be done if you think the focal changes. The water level should be above the nabi. Take this, take picture of body and he can go on doing Australia, touching the body. If after 5 minutes, 10 minutes, he has lunch for going to eat. So you should tell when you have lunch to go to eat, go. In 20 minutes, mushkil should comes. You take video of this with the patient is alive and show it to other patient. The second patient is doing very good things. Okay. And in my practice, I practice urinary conditions, very serious problems. I was thinking, if you give both the medicines, patient is going to respond. Unfortunately, when I give both the medicines, blood is bad balance. Maybe something wrong, maybe solution never help the growth. That happens. Thinking that is kidney disease in compared to feeling that. If malaria is high, creating level is high, I'm giving diabetic medicines high with that. But it is going to worsen conditions. Then I started taking good results are there. But when I came to good results are there. But Putana, I'm getting bad results. Maybe I don't want you to go in this particular room, that's why I'm taking it. Okay? After doing all these things, I was fed up. The patients are not responding. Once we went to Jaipur, there is a national conference. My teacher got to see Pashikla and come there. Just after a seminar and after said I had one cases which are not responding. What should I do? Immediately go to sugar. The general Jesus and disease chapter. They go to sugar. Sitopana Samaya Avashuka. Sabo Buddha Shabana. It's one time. Changes, maybe you will be able to get double price for this. So, you guys consider walking and security. You ask any question, just on the road, it's a big answer. You can ask. The answer is simple, medicine also is simple. Sitopana means you have to take the red color calcium, red sugar candy, Sitopana powder, and Yorkshire. Sitopana Samaya Avashuka, have faith in Sitopana. Using the conditions of getting good results to it. So many persons are there. Most of the other persons have given very good results. But I was afraid, actually, of giving $96. I was giving $48. After giving Sundar, they are saying, I'm giving $96. After giving $96, patient is responding. Now, this is a standard do things. I want to give $96. Because one person was okay before me. Hospital in Delhi. His name was Sitaram Tripathi. He resigned and I met a child there. He used to tell me, what happens such those they got responsible assistance. He gives us those patient faints. But the patient is responding. Maybe 40 ml that were giving is not sufficient to use this. That happened in 79. I was not afraid of giving $96. The textbooks are giving $96, I was afraid. But after this whole business of getting in and all these things, maybe we have to give $96, looking at the condition of the person. So to understand the condition, and then Ustari Abundas have been able to Raja Abundas. Then they have that probably done. One book published by Motila Galaxas. One wonderful discussion is there. Chapter is there. I'm reading. The university slokas in some sorts. Then translation in the other school, we can't Bible. What is there? They have mentioned each Dharpagi. What happens in the Dharpagi Mande? Each Dharpagi Mande, what simple sentences of something our issues as can at all place Dharpagi Mande. Putami Mande. Putami. Swan Pajati Channel. Swan Pajati in clinical case, emotional condition, pathologist chain. But he has given already that other they are public he has given symptomology of different agric shares. And Agridushti share is different Agridushtis. See actually you will get clinical effects. Now this time, you put it in the computer also. At that time 79, no computer was there. You put it in the computer, the patient is telling these things, you can understand. Which doctor is best? So, they are doctor. Then he is using a particular word for unity. Understand how much clever he is. He is saying, Unimia should be called as Shodita Kleda. Shodita Kleda is a word which is accompanied with the Nana of the Vigaras. So, we take the Nana of the Vigaras, or 40 with the Nana of the Vigaras. What is it? So 20. So what is saying is that 80, 40. So it is with the Anatolic Vigaras, one designated mention as a Shodita Kleda. Look at the last thing why you mentioned Shodita Kleda. Motra said they don't want to ask this question. If you had used this answer, she would have been very happy. But the thing is,
this will not, I'm telling you, you should understand. At 73, I'm telling you, I'm trying to rectify myself. When I'm trying to rectify myself, it is your duty also to rectify. So, where you are finding weakness, you should not try to improve on that. See, now, she is asking a question. No question, clear over. Spontaneously, you should have used word, but none of people were answering. Okay. Swedasya clear the thinking. What I think. But again, Patantara is there. Swedasya initial thinking. So, person will be doing was if it is clear the same, they will be very happy. So, there is again another Patantara should go. And your distinction goes on. Now, I was taking my students for distinction to the Alphabet Medical College because they are able to do the after doing all decisions of the meeting, I used to tell, sir, you please stay. I want to know what is your Ayurveda. You at least do Alphabet justifications for Ayurvedic statements. Vedas was some no more knowledge. It is what Ayurveda. Now you are doing PhD distinction. How to justify this as per Alphabet? I am asking, how to justify this as per Alphabet? He is saying, this is the most wonderful statement. This is the most wonderful statement. He is saying, in fasting conditions, when Vedakshaya happens in all places, Vedakshaya does not happen at the level of hookup. The first Vedakshaya happens at the level of hookup. Then go to the pomegranate is the fatty momentum, fatty level. 2 points in a board, full of complete atomic vigilance is coming in your own life. Professor, his name is Ramaya, and the professor later became the dean of natural agriculture, right? Natural agriculture. He is saying, whatever we are describing 1,000 pages, I will be writing in one line. That is a Vedas some good government. So whether our science is great or not.
Great.
We clap them. So, Madam has given wonderful minds and she has converted the whole concept into very, very easy minds. And actually, without making it very difficult, she uses very solid words. Bahut memorization, bahut translation, all these particular things. Still more complications are there. She just only picked up few things so that you can digest. Very hard nuts are there. The same slogan. Very hard nuts are there. That hard nuts she kept. She put before you confuse you. Only nuts which can understand. She does expose those things. Thank you, madam. Gandhi is the modern day nephrologist.
addition to your in Ayurvedic textbook, physiology textbook, modern physiology textbook, in yellow case is the role of this book is taken over by the logic textbook. The statement is there in modern physiology books, physiology books. The emergency, the kidneys are not in a position to work to the capacity. Then the kidneys will take over the intestine will take over the responsibility of the kidney. This statement is there. At the same time, Bhakti is required. As Bhakti has mentioned, something Bhakti. You have tried many Bhakti. Whatever the Mutras are there, Mutras, Mutras, Sugar, Kashayas of those are made and given as a Bhakti. Because in many Mutras, this is the one issue I want to state. So Bhakti is not just medicine, one medication. Bhakti also may be one of the best solutions for these problems.
Actually, when you're talking of dialysis, in the modern textbooks, regular dialysis is being done by the modern people. There is a word like entry dialysis. So intestines also would do dialysis. Peritoneal dialysis, different type of words are there. Having on Basti is dialysis magnified, dialysis will more infinity. That modern dialysis will have limitations, but our dialysis will not. Sometimes really impressed and done with the modern day Canada. So actually some really good books have been written. You should read these books. One book is by A. Arnish. Name of the author is A. Arnish. Name of the book A. Arnish is an author. Reversing the heart disease. Reversing the heart disease. So A. Arnish, an American doctor, came to India, studied Ayurveda, studied yoga in the university, and he told that changing the lifestyle is going to do this. So this was done somewhere in 1980s. Dr. Chandra, who is the national professor in American medical science, goes from all over India. In the university, what is the charges fees for one person? He doesn't do medicines. He doesn't do water also. Like 7 days in camp, he does. He teaches how to cook food without oil, without fat, everything. And he charges 50,000 rupees for 7 days. 50,000 just for teaching. Maybe sir, you should do this. Because they've got cardiac specialties. Externally, they've got cardiac diploma. When Chandra can do it, why he cannot do it? Yes, it's nothing wrong with this. They are going to do other things. What is saying? You do this pranayama, you do this yoga. Yes, Dr. Chandra, CMJ Chandra. He is working as a national professor in the Department of Medical Science. He is not even MD medicine. He is a physiology person. But physiology person is studying understand it. Then he can do it by the time Sundar has to do. Yes, sir. Yes, sir. Similarly, so this is what is called as bypassing the bypass. Bypassing the bypass means already people are doing bypass. Okay? We are already people, the leaders of Sundar, we want to bypass the already bypass. We want bypass like that. Then you know what how this is happening. We had a seminar with the best professors of science and Ayurveda. They really want to understand the 100 heartbeats in the heart. The 100 heartbeats in the heart. That's their word. So when we do proper pranayama, exercise and the food as indicated, the 100 heartbeats become active. What is possible by surgery, same thing can happen by our procedures. That's the 100. We did the what is called as Society for Lifestyle Management and Control of Disease. We did Mysore long back. Then Stanley Medical College, DM, again, Chowdhury identified triple vessel blocks. Would be that is very long back and very proud that they are belonging to Ayurvedic fraternity. And you can beat this structure, you can beat next. If all the people come together, it can be a better capacity. Correct? We want to do it. Thank you, sir. In the Pune, they are doing Urobasti. Good person. But this university concept was started in Kerala. Kerala people came and presented the paper and they jammed it. Then they told sir, we can attack those people. We should attack us. But so they should not do so. You are doing the national art by doing this university. Then sir, you see the photo. We are not doing any art. We are doing the science art. We are not doing that. We are doing this thing. So we are not doing the art. So, okay, when we are doing this roles, the order of the time is taken is taken Chandra, the Radhishna Darukshana, Sushma Darukshana. If you write Lavana, it will be more potent. In Pune, what that is Guru Biju. Mobile level, they demonstrate Guru Biju for 7 days. But they charge, nothing is free. But then you have to take it to go home and do Guru Biju. By doing Guru Biju, you can do that for days. Because Granavayu, opposite is same. Granavayu Sushma is there. So each one has each Granavayu, Sivana. Samavayu, Karavana. Each one is separate one. Then they are going to antagonize this by going road. Okay, thank you.
I suggest one medicine here, which is a brand of Christian medical college. Actually, they have not published it. There was a one doctor, K.G. Arya, who prepared a drug known as Nabi, not Nalguni, Nabi, prepared Dr. Vasanatha, Shuddha Vasanatha. What is that? Because none other than that. But there is one, just because the Nabi is given with a Alpha, so we have to add mass and sugar to it. Mass 3 times mass and sugar. So we have to prepare it by Dr. Lucilasa or Percocet. In all the two cases, whenever severe painful medicines are there, in all those cases, you can use it as emergency painkiller. Particularly, we have used this name called the MI cases. When the patient comes to us with MI complaint, we ask the patient to keep that small pill, sustainable plus body, not bigger or small pill, keep it under control. Within few minutes, patients get complaint will relieve. This we have experienced many patients. Actually, they don't give, we have to go to the hospital. Actually, go there, we have to go to the hospital and make movement sleep. Then we have to get admitted by the doctor. Then we have to purchase it. There was a situation that probably I don't know whether it's available or not, but we can prepare it. And we know the formula told by one of my senior so this Sundar Raj plus 3 times the mass sugar, just to add one kit, make it another sugar, another power, PC power. If it is PC power, we should above the diaphragm. If it is under the power, we should below the diaphragm. And anyway, whenever the pain is there, we can use it. This is the one thing. And the one more thing, output capsules. I have given to one of my ophthalmologist friend who had bypass surgery. Then I gave the particular tablet. Asked him to take as long as he can take. He was taking. Once he went to the doctor, consulted doctor there. GMT was bad. Usually GMT was is there reports are there. They do reversal of that. There was a reverse of that GMT. Then there was the doctor was the wrong reversal of the observations. Then he was taken to the senior doctor. Then this Sundar Raj Telugu. Then the senior doctor said, "Look at why miracles happens with you." Then he said, "Not a miracle, sir. It is a carrot, probably capsule I am taking. Muscle advice doing it is probably actually the cause of this." So in this we have some wonderful drugs with us. We have not tried them, so therefore we avoid such cases. Whenever the case comes, we must take them, try some medicines, whatever we can try. So there is solution. That is why don't hesitate to take any such serious cases. We can handle serious cases. Usually what happens, we have the live drugs are working slowly. It's not like the live drugs also can work as better than bottle drugs sometimes. I have seen them. So that is why don't have such any initiative about any emergencies. Handle emergencies. Contribute. These are such.
So, I'm happy, if people are designing, you are really happy. What is the next phase? When you go back to your college, you should go and talk with the principal and sharing it with the private college. Madam, we invite Sundar Madam to the college. There are company that should come there and do lecture on college. That Sundar should come and do lecture on heart problems. So that way, we are promoting the science. Will you do this? Will you do this? Thank you.
So, thank you so much for all the doctors for sharing wonderful knowledge. Our heart is full, mind is full, stomach is empty. So, we'll have a delicious meal and we'll come back for entertainment sessions as early as possible. Now it is 7, we'll come back at 7:30. Let's go. Just have food and come here and relax. You can lie down also here. You don't have to sit like this. We will remove all the chairs. Put your mattress and lie down and listen. Okay? Come back soon. Let's go.